I didn't want to just be fitting glasses. I wanted to make a difference. When someone came to me, I wanted to be the person who saved their life or who gave them the extra 5 years of life.
Dr. Shields, welcome to Adventure TED Chats. We're so excited to have you today. Thank you for joining us.
Yeah, thank you for having me here. This is exciting for me too.
Well, if you could, tell us a little bit about yourself. Where are you from? What do you do for our audience?
Yeah, I was born in Western Pennsylvania, so I lived in the kind of the middle-class coal country of Western Pennsylvania, and gradually made my way to college at Notre Dame. And then I decided I wanted to go into medicine, so I went into medical school at the University of Pittsburgh, and then on to my career in ophthalmology in Philadelphia. So I've been in Philadelphia now for almost 40 years.
Wow, that's incredible.
Yeah.
Did something specific inspire you to go to A, Notre Dame, and then B, to get into medicine?
I attended the University of Notre Dame, so there's many different Notre Dames, in the U.S., but I attended the real one in South Bend, Indiana. Growing up in Western Pennsylvania, that was the epitome of where you could attend.
That's incredible. And then all the while knowing that you were going to study medicine, how did you know specifically that medicine was the career for you?
Yeah, I was in the College of Science, and I was thinking some field either in medicine or related to medicine. I was thinking maybe I would be a pharmacist or maybe an optometrist, never quite taking that giant step into medical school. But the closer I got to my senior year, I said, I just want to be a doctor. I really want to take that final step into medical school, knowing that it was going to be a little bit of an uphill climb.
More specifically, what made you decide to go to be retinoblastoma specialist?
Yeah. So when I was in medical school, I found a liking to ophthalmology. So I applied for ophthalmology residencies, and I wound up in a very good residency here at Wills Eye Hospital. This is the leading ophthalmology residency in the U.S. I studied real hard during my residency and realized that I really liked probably the most serious part of ophthalmology is dealing with the cancers. I mean, it's real medicine, and you're making, by your diagnosis and your management, you're not just saving vision, but you're saving a life. And that really appealed to me. I felt I'm true grit. I can do this. You don't go into this field if you have any hesitation. You really have to want it. It is a lot of work. So when I went into ophthalmology, the entire field appealed to me, but I really wanted to make a difference. I didn't want to just be fitting glasses. I wanted to make a difference. When someone came to me, I wanted to be the person who saved their life or who gave them the extra 5 years of life.
Incredible. And how have you seen, so retinoblastoma is obviously anyone who hears that from their doctor is probably pretty concerned, especially, probably everybody, but especially if it's a child. The parents must be very concerned. What are some, over the course of your career, some changes that you've seen to the industry, hopefully for the better, or any insights or research that's coming through, or treatment therapy and so forth?
Mm-hmm. So much has happened during my career. We understand the genetic mutation that causes retinoblastoma. We can test for this genetic mutation. We can actually detect the tumor in a woman's uterus. If she carries the mutation, we've actually found retinoblastoma in the fetus, delivered the baby, and treated the baby. I mean, we can catch this tumor really early. We've also had innovations in the way we treat. Back in the day when I started, we just basically had two ways to treat retinoblastoma. We could either remove the eye or radiate the eye. Neither sound palatable. Nowadays, we hardly do either. We treat the baby with chemotherapy, and a chemotherapy that's very kind to the baby. The current chemotherapy that we have, your baby's not likely to die. We're likely to save one or maybe both eyes. Most of the time we save both eyes. And if we're able to save the eye, your baby is likely to have better vision than they have now, and they might even have vision good enough to drive a car.
That's so hopeful, and I'm sure a lot of people listening right now are, you get a diagnosis like that and panic hits right away, and then to hear something that reassuring that we've come such a long way over the past 39 years, that's very optimistic and wonderful to hear, frankly. And I guess my next question would be, what would you say the biggest challenge is right now for retinoblastoma, and what can we do to make it even maybe less traumatic?
Toxic?
Yeah, less toxic, yeah.
So chemotherapy sort of scares people because it's chemotherapy, and it may cause the blood counts to drop and the hair to come out, and the baby looks sick and they look pale, but that's while they're on the chemo. My hope is we eventually get away from chemotherapy and get into maybe immunotherapy or viral therapy. It's a little more elegant than chemotherapy. So I'm hoping, in the next 10 years, we will be using something that's maybe a little less toxic. But the other concern is if a child gets the disease in both eyes, there's a risk they can pass this on to their kids. But we have masterminded that, and we have figured a way to minimize them passing it on to their kids. What we do is in vitro fertilization. We take the wife's egg, the husband's sperm, we do in vitro fertilization of like 8 eggs, and then when the eggs grow into a little embryo, we sample each one, and we can find the 4 that carry the mutation and the 4 that don't. So we implant those that don't into the wife, and she carries the fetus normally.
That's great to know, and with all of the abilities to kind of pre-screen for it, that's super uplifting. But I do know, human nature, and I would say that there's a great amount of people that won't get the test or won't get the genetic testing. And I wonder, are there any tall tale signs that parents can look for in their children if they didn't prepare for that, just because, for whatever reason?
Yeah, very, very good point. So who originally discovers retinoblastoma in a baby? It's not the pediatrician. It's not the eye doctor. It's mom or dad. So mom and dad really should know the features of retinoblastoma. Yeah, the most common features: leukocoria, that means leuco means white, coria means pupil. So if a child has a white pupil, like my pupils are black, that's the color they should be. When you take a picture, the pupils look red because light's bouncing off the back of your eye. But if the pupil, one or the other, looks white, that's a sign that there could be retinoblastoma in a baby. If you take a cell phone picture with a flash and the pupil's white, you got to go see a pediatric eye doctor right away, because that could be retinoblastoma. The second most common feature that parents can look for is a crossed eye. Babies' eyes should be straight. If one eye's drifting out, like it's not seeing, that could be a sign that there's a tumor in the eye. Babies won't come up to their parents and say, "Oh, I can't see."
Mm-hmm.
They don't say that until they're like 8 years old.
Right.
They'll go blind and think that's normal. So you can't rely on them telling the parents. and they're not going to say they have pain because this tumor doesn't produce pain.
Yeah, no, it's good that hopefully a lot of people will be seeing this video to know some of these telltale signs, because that'll be super helpful in preventing it from getting any worse. But now, another question that I have is that since, of course, just as important as getting it treated, I would imagine would be some of the support groups afterwards, mental support, helping emotional support with families and parents. Even though it is very solvable, I would say, there's a certain amount of, with any cancer, hearing that you have the C word typically is a little jarring. And then, of course, there's certain things that only you can understand if you have it or are going through it. So I'm wondering, are there any support groups for children or parents that you've seen some success with that are helpful in helping patients and patient families through this process?
You're right. This can be a psychologically disturbing situation for the entire family, even the nuclear family and beyond, even friends of the family, just because it leads to a lot of stress and a lot of anxiety. So beginning with maybe the simplest thing is having a counselor, a psychologist to talk to, and there are specialty psychologists who deal with pediatric cancer. And I do think that's really important. The other thing that might be even a little bit more socially acceptable, there are online groups, retinoblastoma mothers or retinoblastoma parents, and there's even meetings where the retinoblastoma parents attend so they can be really educated by us. Like, we go to these meetings to educate the family. And then they even have like summer camps where the retinoblastoma kids and or their siblings can attend, so they feel they get really good kind of like psychological care and fun and enjoyment, so it's not as stressful for them. So they realize that they have good help just in their family and at this camp. So there's a lot of services out there to assist with retinoblastoma care. And what happens on social media, like in a retinoblastoma parents group, someone will say, well, I met with Dr. Shields today and I have to start a new type of chemo. And somebody else will say, oh, I've been through that exact same chemo. Don't worry about it. It only took 4 months and everything went okay. So they hear from their colleagues. That is, usually it's reassuring.
That's incredible. And I would say also, like, when you're in the middle of chemo, I imagine you feel pretty rough. It's nice to hear that someone who's done it for 4 months and then feels better on the other side of it. It's nice to know that there's an end goal, so to speak, and that it'll be better.
And the best is when you see these kids come back, say they're 25 years old, and they come back with their baby. So they live a normal life. They get married. They have children. And they bring their baby back. I mean, I've been around long enough now to have seen many of the children I treated years ago come back with families. And they're so happy they've made it that far. They're able to have a normal life. Maybe a normal life with loss of vision in one eye, good vision in the other eye, but just to know that they're cured from this cancer. And this is a cancer that typically does not come back to haunt you 25 years later.
That's great that you can really just live a normal life like that afterwards. And I can tell when you were saying that the level of fulfillment it brings you to see a 25-year-old patient who's doing so much better and bringing their own child. That's amazing, and I'm so glad to hear it. And wow, I really enjoyed this chat. Thank you so much, Dr. Shields. We really appreciate you coming in to chat with us and sharing your story and some of the more uplifting results with your particular industry and field. And can't thank you enough. Thank you for joining us.
Thanks a lot, Tommy. I really appreciated this, and this was a lot of fun just to kind of think back on ideas and reasons we do things, and it made me kind of understand a little bit more of why I have this drive to make the world a better place.